Good morning, Lynchburgians. Is that what you call yourselves? Great. Thank you very much. For those that are online, I want to thank you all as well. We are currently in Lynchburg, Virginia, and this is a Compass MS Care Reaching Rural America and Underserved Communities program. My name is Stuart Schlossman. I'm president and founder of MS Views and News. Our sponsors are Bristol Myers Squibb, Genentech, and TG Therapeutics. And outside, we have exhibitors. We have Alexion, Bristol Myers, and TG Therapeutics. All right, so we want to give them all a round of applause. Thank you for helping support our program. All right, Tina Allis. Tina Allis is a speech-language pathologist specialist in Lynchburg, Virginia. She graduated with honors in 2004, having nearly 30 years of diverse experiences, especially in speech-language pathology. Tina works for Encore Rehab Services since 2015 at a Heritage Hall in Brookneal, Virginia since 2018. Let's welcome Tina, but before I do, in January 2023, she opened Speechless No More LLC for outpatient speech therapy services. And again, we're welcoming Tina, who's one of your locals.
So I'm going to talk about speech-language pathology issues in MS. There is quite a variety of different things, and as you can tell, my voice is one of those issues we can have with MS. So we're going to talk about dysarthria, which is slurred speech, dysphagia, which is swallowing, voice, cognition, and dysphagia, which is different than dysphagia for swallowing. Dysphagia is actually has to do with your language center in your brain. Now, aphasia is another one, but that's a different thing, and that's a loss of language, and most people that have that one have been associated with stroke. So let's get rolling. We're just going to do a quick anatomy and physiology lesson. It's not going to be terribly complex. I'm going to keep it as simple as I can and as understandable as I can. So there are a variety of different structures involved with your speech and language communication centers. Your brain is being the first and foremost. It controls everything, your muscles, your nerves, all of it. We know that in people who have MS, cranial nerves are one of the things that can be affected in your head, neck, and thoracic region, which is what we're responsible for as a speech-language pathologist. All right, anatomy, structures, and function. So your head and neck involves a lot of different parts. Again, your brain, your skull, some of the more obvious ones. Things like, let's see if I can get this to work. Your lips, your cheeks, your tongue, your jaw, and there are 13 muscles that are involved with your swallowing, your speech, and your voice. So the cool thing about those 13 muscles is they control all three of those. So if you have an issue with one of those three things, then you're more likely to have an issue with all three of them. Swallowing being the biggest one. If you have issues with your swallowing, as we know in people who have MS, that sometimes they can be subtle and sometimes they are more severe and more obvious. If we can rehab your swallowing, then your speech and your voice will follow after the fact. If we're looking at just your speech, if you have dysarthria, which is that slurred speech again, if we can, let's see if I can there we are. If we can rehab your speech, then your swallowing tends to improve and so doesn't your voice. If we're looking at just your voice, then with the exercises and rehab we're doing for your voice, your speech and your swallowing will fall in line. Because again, those 13 muscles are involved for all three of those processes. And we're going to get into a little more of the specifics in just a little bit. So there are 4 cranial nerves that are the primary functions for these 5 things over here. So cranial nerve 5 is your facial nerve. It's called the trigeminal nerve, and it branches out in the sides of your face like a tree, with the branch of the tree located right in front of your ear. Cranial nerve number 9 is called your glossopharyngeal nerve, and that is the one that controls your throat muscles. Again, there's 13 muscles for your swallowing and such things. that glossopharyngeal, your throat, controls 12 out of those 13 muscles. The 13th muscle is your tongue, which is controlled by cranial nerve 12, the hypoglossal. Cranial nerve number 10 is your vagus nerve, which controls your larynx and your voice. Now, your larynx is your Adam's apple. That's the tip of the iceberg, if you will. Your throat, like your larynx, what it's called. It's actually made up of what we consider a carriage. So there's some structures in there, and at the tip of the iceberg is your Adam's apple. And I can talk all day long on anatomy and physiology, so if any of you want a more detailed lesson, let me know. So we're going to start with swallowing, since it seems to be the most obvious one of the MS things that I look at as a speech pathologist. And it comes along with a variety of different severity levels. Sometimes it can be very mild and very subtle, and sometimes it can be pretty serious and life-threatening. So the three phases are your oral phase, which starts as soon as you put the food in your mouth. And then it goes back until it hits the back of your tongue, which is right before your tonsils, if you still are lucky enough to have them. Your pharyngeal phase starts at the top of your throat by your tonsils, where the oral phase ends. Now, there's not a clear-cut line per se. So sometimes this will overlap this, and then this can overlap that. So your pharyngeal phase, like I said, starts at the back of your tongue and goes down till it hits the top of your esophagus or your food tube. And then your esophageal phase starts when the food hits the top of your food tube or your esophagus until it empties into your stomach. So again, this is just another slide to kind of explain how those phases work. So your oral phase, like I said, begins at the lips and ends when the food or drink enters your throat. It's a very complex system. It runs on timing. It runs on a system of pulleys and levers. If one thing gets out of whack, the whole thing kind of fails. Some of the other things we look at as far as like your oral phase is how you control the food once you put it in your mouth, how you get it to form into a little ball so when you get ready to swallow, you can swallow it. And again, the food, what's important to know about that is it can vary from the weight of the food into the size of the ball that you form in your mouth before you get ready to swallow. So your pharyngeal phase, I have to lean over because of the way the chair is, but anyways, begins, like I said, when the food enters the back of your throat, right at the level of where your tonsils are. Again, it's a timing thing. If your oral phase goes too fast and your pharyngeal phase can't keep up, most people will cough and choke a little bit. Your throat clearing and your coughing are usually two good signs that you're either having a problem or you're trying not to have a problem. And then the last one, your esophageal phase, is mostly medically managed because there's a lot of different things that can go wrong with your esophagus, from anywhere from the timing, the motility, or the being able to move the food down through your food tube, which we also call peristalsis. And now we're going to talk about some of the voice and language. I know that was a really quick overview of the swallowing. I will be glad to take questions and answers at the end when I'm completely finished. One thing I did want to mention about the swallowing, now that you all have eaten, I didn't hear anybody choking, by the way, so that was a good thing. I'll just talk about swallowing for just a little bit. So again, like I said, sometimes when people start to have an issue with their swallowing, whether their muscles are just getting weak from age, from overuse, from illness, from an MS exacerbation, usually the first clinical signs we see are throat clearing a little bit. I see a couple of you are using straws, which is a great compensatory strategy, which is a whole nother topic. So coughing can indicate that there's a problem. After you get done eating, during eating, or in that, not necessarily in that order. When the food tries to enter into your airway, it's going to make you either throat clear or cough. Again, it's a double-edged sword. The throat clearing and the coughing can indicate a problem, or it can indicate the fact that you're trying to avoid a problem. If the food is trying to enter into your airway, then you're going to get one of those two things to happen. If your system will not allow you to do one of those two protective mechanisms, sometimes you can end up with aspiration pneumonia, because the food or liquid is entering into your airway and your lungs can only handle a certain small amount of liquid to enter into your air, into your lungs before it becomes a problem. The thing with food, and I noticed that some of you are sweetening your tea. If you are aspirating on your sweet tea, you are going to develop aspiration pneumonia faster than somebody who's drinking unsweet tea, because the sugar ferments faster than anything else. It likes to turn into bacteria quicker than a non-sugared drink. Definitely consult your healthcare provider if you feel like you are aspirating. Sometimes it's silent, where you're not going to know if you are, and you're just going to end up with pneumonia. If you do get recurrent pneumonias, please, please, please contact your healthcare provider, and they can and probably will refer you to speech therapy for aspiration. There are definitely things and measures out there that I can do. Not everybody is certified to do the things that I am able to do. There is a process called electrical stimulation. It's called, one of the machines we use is called VitalStim, and you have to be specially certified in that process, which I do hold that certification, and I have since 2007. All right, so let's get on to dysarthria and dysphagia. So dysarthria is a speech disorder that's characterized by slow, slurred, garbled speech, which makes it difficult to understand the message that you're trying to get across to somebody else. Not a lot of times, but sometimes when you have dysarthria, it can be a side effect of MS exacerbation. It can be a side effect of some other neurological issue that has either happened or is going to happen. Dysarthria is one of the main signs of having a stroke. So please, if you have a sudden onset of dysarthria, call your doctor or call 911, because, like I said, if it's a sign of having a stroke, you need to immediately get help. There are medications and different things they can do in the ambulance and in the ER that will help prevent that from getting worse and or getting as bad as sometimes what I've seen. And then dysphagia is just the disorder of language that makes it difficult to be able to find the right word when you're speaking. A lot of times with dysphagia, we see it in MS patients as a side effect of a exacerbation. And the severity of those two things, if you're having an exacerbation, sometimes do get worse, especially if you have them pre-exacerbation. Okay, voice and swallowing. So I am actually having the perfect example of a voice issue this afternoon, with hoarseness, and mine is from allergies and coughing, which again, that's an issue as well. That's for another discussion. So there are 13 muscles control your swallowing function in your voice. So if I want to make my voice louder, I'm going to exercise it, just like anything else. It's a muscle. It likes to exercise. When it gets weak, it likes to exercise to make it get stronger and better. If I want to improve my swallowing, we're going to exercise it. So as we exercise the swallowing, a lot of times your voice will get louder. It'll get more clear. And sometimes it can become a problem for your spouse, because then all of a sudden they can hear you, whereas maybe before they could not. So some of the symptoms may include of swallowing difficulty. Again, I kind of breezed over some of these. This is not an all-inclusive list. Sometimes, from what I've seen in my years of experience, is you're not going to necessarily have all 5 of those. You may have one. You may have one at the top. let's see if I can get this pointer to work. You may have this one. You may not have that one. You may have that one. You may not have that one. And you may have that one. Or you may have this one, this one, this one, and none else. It just really depends on which swallowing muscles are weak or deficient and which process of your swallowing function is gone awry. So some of the top 5 things I see are coughing during and after eating, drinking, and or taking your pills. Again, a lot of speech therapists or pathologists don't necessarily look at taking medications, but we all know as patients with MS, including myself, sometimes taking pills is more of a nerve-wracking experience than just eating and drinking. Difficulty chewing. If your chewing muscles, which I didn't include in that other slide, are deficient, you're going to have trouble opening and closing your jaw. And there's also, with chewing, comes a strength. If you have no strength in your jaw muscles, your chewing is going to be inefficient. And that presents a whole nother set of issues for swallowing. If you have leftover crumbs in your mouth after swallowing, that can pose an aspiration risk. Due to if they sit in there, either on your tongue, in between your cheek and your gum line, they can slowly make their way down your airway. And then if you don't have a good gag reflex or a good cough, then they can end up in your lungs and create aspiration pneumonia. All right, use of safe swallow strategies. So that sometimes can prevent this. Things like alternating your solids and your liquids. What I like to tell my patients is start with a drink. Wet your muscles. Your swallowing muscles specifically like to move when they're wet more efficiently than when they're dry. Again, like Megan said, staying hydrated is a big, big thing when it comes to swallowing issues. If your muscles are dry, they do not like to move. It runs on a pulley and lever system like I mentioned before, and if the pulleys are dry, you can only imagine that creates more friction than it does a smooth gliding action. And then recurring pneumonia. If you're getting recurring pneumonia, the likelihood of you aspirating is greater than not. Again, consult your healthcare provider, and they're the ones that will refer you to speech therapy. And if they don't, you need to ask about it. We're gonna move on to voice. So this first one is what I'm experiencing right now, a hoarse, gruff sounding voice. A lot of times when you have this, your vocal cords are often inflamed and they don't shut all the way closed like they're supposed to. When it comes to voice, you have 2 vocal cords, one on the left, one on the right. And they're supposed to shut completely like that double door in the back of the room. When they don't, then that's a problem. It can also lead to aspiration because your airway is left open. It doesn't seal it off. When they're swollen, you get the voice like I'm having right now. If you have one vocal cord that does not work well, the other one sometimes will move more over than the midline where they like to rest to help the one vocal cord that's not working well. There are exercises and things we can do to help you get an optimal voice, as well as exercises to do to make those vocal cords work evenly instead of one working harder than the other. If you have ever seen an ENT doctor, they're the ones that usually will put the camera up your nose and look at your vocal cords from down at the top. And they're the ones that will be the ones to diagnose some sort of vocal cord dysfunction or paralysis or paresis, which is weakness. Sometimes when people get a voice like I have, they have what they call unilateral vocal fold paralysis, which is a big fancy word for one side of your vocal cords doesn't want to work and the other one is having to work too hard. So sometimes when the ENT doctor takes a look at your vocal cords, he can very easily tell which side is working harder than the other one, because that one seems to stay inflamed. Things that can affect this: reflux. If you have acid reflux and it's bad enough and for long enough, you're going to get this kind of voice, a hoarse, gruff sounding voice like mine right now. Sometimes people who don't realize they have reflux, they go in complaining of a hoarse voice and they don't know why. Then they get, from their primary care, they get referred to ENT, and they're the ones that discover they have what they call silent reflux. You don't always have to have heartburn to realize that you have reflux. If it's silent, it just means that you're having it and you don't know it. And then a breathy, soft voice, I'm going to see if I can do this, is where your vocal cords don't come together. I'm going to do a quick demonstration. Let's see if I can do this. Stuart, can you help me for a second? Can you hold the microphone so I can do this demonstration? I need both my hands. Or I didn't want to embarrass him too bad.
Sure.
All right. Okay. All right. So your vocal folds, let's see if I can do this. Your vocal cords come together like this as a doorway. When you speak, they open. And let me go. I got that backwards. I'm sorry. So when you're at rest and you're breathing, they're open. When you go to speak or swallow, they close. If they only get that way, you're going to get a breathy voice, kind of like this. That's more of a whisper, and it's really low. So those of you that have hearing aids probably may not be able to hear me right now. So anyways, that's a soft, thank you. That's a soft, breathy voice, which takes a lot of energy to replicate. Sometimes if you get too hoarse and you get laryngitis, you'll end up with that breathy, soft voice, and it sounds more like a whisper than it does anything. That is a voice difficulty. It's a voice issue. You need to be seeing a speech language pathologist for voice therapy, which again is one of the areas we're responsible for, among the other 4 or 5 areas. Let's see what's next. Cognition, memory. There are six areas involved in your cognitive function. Attention to task, memory, which is a lot what people talk about. They don't always talk about the 6 pillars of cognition. Problem solving, new learning, your perception, and your thinking and orientation. Most people think when they talk about cognition is that one right there, your memory. Again, that's the most common one people talk about. But all of these other things are also involved in your cognition. If you can't pay attention to a task, then you're going to have difficulty eating. You're going to have difficulty doing any routine activity of daily living that you may enjoy. Reading, doing puzzles, playing games. All of those things are going to be affected, and they're going to make it extremely difficult to be able to complete your tasks. The other thing we look at when we look at attention to task, activities of daily living. We all know we do them every day, all day long. We just don't realize we do them. It's not just bathing, dressing, using the bathroom, clothing management, up and down, out of the chairs, on and off the commode. If you have this attention to task difficulties, the process that is involved in all of those tasks are going to be extremely difficult. And it also is going to affect this because you're going to forget where you are in the process. A lot of times, not always, and it's not a guarantee you're going to forget where you are in the process. It's just going to make it more difficult. So for your memory, that is just straight up being able to remember day-to-day procedural things. There's also short-term and long-term memory that's involved. Your long-term memory stays around a little longer than your short-term memory. The short-term memory usually goes first, and it presents more of a problem than not, because the long-term memory is responsible for just that, your memories that have happened more than a day ago or a week ago. Your short-term memory are things that are happening within a short period of time. Things from anywhere from 5 minutes to up to the entire day. Being able to solve a problem. When to know to get medical help. When to know to call 911. When to know how to use the phone. New learning. Learning a new skill is probably the best thing you can do for your brain health. That right there is going to preserve what you have and even potentially make new connections in your brain. So all of us older people, I don't see very many young people in the audience, but some of us are older than others. Using a cell phone was not necessarily, it's a newer task, not necessarily something we grew up with, unlike most of our children. They grew up using the internet, using the phone. So if you don't have a computer or a cell phone and want to learn how to use the internet, that is a great new skill to learn. If you want to switch phones, if you want to go from an Android to an iPhone, again, that's a new skill. If you don't know how to do Sudoku puzzles, find somebody who does and have them teach you how to do them. Again, a new skill. New learning, super important in brain health, like Megan had mentioned. Perception, that is a loaded topic. There's a lot of different kinds of perception. There's time perception, there's calendar perception, there is just general perception, how you perceive things that you hear, that you see, things that you've experienced. And we all know sometimes if one if one area gets out of whack, it doesn't work as well as it should, then some of the other areas in perception can kind of follow suit. So again, needs to have some attention by a speech pathologist. Thinking and orientation. This right there, orientation to time, is your use of calendar and knowing time frames and when to show up to an appointment on time, how to know when it's breakfast, how to know when it's time to take your pills, those sorts of things. A lot of times what I do when I see folks who have orientation difficulties is the use of a calendar, written information, time reminders. For all of you who use the cell phone, using the calendar in your cell phone and the time reminders, the alerts in your cell phone, extremely helpful. I know for myself over the last couple of years, I've had to rely more on the time reminders and the calendar on my phone versus when I was younger and first diagnosed with MS. I was managing 4 people's calendars from a little calendar hanging on my refrigerator. I had my husband's schedule, my schedule, and the 2 kids. Who were involved in every activity under the sun, it seemed like at one point. And I was able to remember what was written on that calendar from day to day as to who needed to go where. Now, if I had to do that, I'd be in big trouble. So I actually had to move everything off the calendar in the kitchen to my phone. So, and since the kids are grown and out of the house, obviously, I don't have to keep track of their schedules anymore. But it's just really kind of keeping track of my own schedule these days and maybe giving my husband a little bit of help with his. But now that we have 6 grandchildren, trying to keep track of where they belong and who they belong to sometimes is a little bit difficult. But it's all good. So speech therapy treatments, things that we can do to help you. Again, the swallowing, the dysarthria, and the voice are all 3 of those are connected. We have exercises for your mouth and throat. There are postural maneuvers, things like these 3 fancy words right there, chin tuck, the Masako, and the Mendelssohn, and we'll get into those in a little bit. And since you all have liquids on your table, we may try a few of these. And then, of course, you get the big fancy neuromuscular electrical stimulation, better known as vital stim. I'm going to talk about this one a little bit because that right there is a passion of mine. I've discovered since 2007 that this thing called VitalStim has been a tremendous help in my remediation of swallowing and voice disorders. Since those two things are controlled by the same set of muscles, it's super easy to influence one while rehabbing the other. VitalStim is a certified protocol that as a speech language pathologist you have to go back to school for. Let's see if I can remember how many hours it took me. I think it was 28 clinical education hours for me to become VitalStim certified. The first 12 were online with reviewing videos of how people swallow on an x-ray machine and relearning about anatomy and physiology and how everything works. The second portion was in-person learning, back when that was still a thing. And that was 16 hours, so it was 2 8-hour days. And I had to travel to Charlotte, North Carolina to take my class, and it was intense. It was put on by a physical therapist and a speech therapist, because the physical therapist went over the physical characteristics and the general principles of electrical stimulation. I don't know if any of you have ever had physical therapy. My guess is we probably all have at some point or another in our lives. And a lot of times they'll use electrical stimulation for pain control in different areas of your body. For example, I'm just going to give you one that I had experienced. I had messed up my left knee. Don't know how I did it. Don't know what I did to it. I assumed it was an MS thing. I just messed it up. I twisted and turned it the wrong way, or I fell, or some sort of something. And I was having a lot of pain in that knee. They put me in a big fancy brace and sent me to physical therapy for 8 weeks. In the course of those 8 weeks, the first thing they did was hooked me up to an electrical stimulation machine, a TENS unit, to get my pain under control, because it didn't matter what I took, and I could not take the narcotics and still be able to go to work. So I ended up with a TENS unit, and it did a wonderful thing. So the VitalStim is kind of a glorified TENS unit, except for it goes on a front part of your throat, right in between your two carotid arteries. And we turn the machine on and we electrically stimulate your swallowing muscles to get stronger and faster. And it's easier and less effort on your part. So if your MS is more progressed, whether you have relapsing, remitting, or progressive MS, this process right there is super easy to use. Especially we know with the fatigue levels we all experience in MS. So we're talking about neuromuscular electrical stimulation and VitalStim. It has been a huge benefit to my experience in working with people with MS and other neurological conditions. It's not just MS, guys. It's Parkinson's, it's stroke, it's anything that involves your brain and your nerves. And so I love it. I use it as often as I can get my hands onto using it. It's been a wonderful thing. It's really grown my ability to help people and my ability to make a difference, especially with their swallowing. All right, we're going to move on. So dysphagia and cognition. Dysphagia, again, is that difficulty with language, which is a little different than aphasia. Aphasia is actually when you lose your language abilities as a result, most of the time, of a stroke. That's not inclusive to that. Sometimes people with other neurological conditions have aphasia as well. But we're going to talk about dysphagia and MS because, well, frankly, that's why we're here. Word finding. That is the biggest difficulty that I see with people with neurological issues, especially with MS, is that when you're talking and you're just going along your conversation and, oh my gosh, there it is. I forgot what I was trying to say or what word I was looking for. I know we've probably all experienced it at one point in our lives. When your brain gets going too fast, sometimes it just can't remember what it wants to say or which word you wanted to use. Right now, my brain is going 800,000 miles a minute, and it's trying to figure out how not to use all of the technical terms that I've learned and that I know how to use over the last nearly 30 years. Because if I did, most all of you would not have a clue as to what I was talking about. My husband would, because he's been around for all of those years. But anyways, and then again, we talked about the cognition issues with calendar use, card games, and other games are tricks and tools that I try and teach my patients how to use and how to make things easier on their lives. Again, calendars for cognition and orientation to time is a huge benefit. Visual aids, anything you can see and hear and speak about are three big things that will help you being able to remember things, especially if it's new information. New information is always the hardest to learn. A lot of times what I like to do is put it to a song. Use it, pick your favorite song and sing to it. Sing the information you want to learn. Music is also another good tool that I like to use because everybody seems to like music, whatever genre of music you like to listen to. Card games. A lot of the folks that I see as patients are older folks, and even young folks like to play cards. You just kind of have to tailor it to whatever population you're seeing. Learning a new card game. If you're not a card player and you want to learn how to play cards, find somebody who knows a little bit about playing cards and strike up a game. Again, we talked about new learning and memory. Other games, there's apps that you can find on your phone. If you just want to go to your app store and search memory games, there's a whole bunch out there. I couldn't even pretend to list half of what's out there. If it's a game you're not familiar with, you don't know what it is, check it out. Google it. Download the app. Most of the memory game apps are free. I don't ever recommend anything else than what's free and available on the internet, just because that's just the way I work. Let's see, what else do I got? That's it.
All right.
And I am going to, that right there at the end where it says Speechless No More, again, like Stuart said, it's a brand new business I just opened for outpatient speech therapy in the Lynchburg and surrounding areas. I did bring some business cards with me, and I think a few of you have them. If you want to learn more, look me up. I'll be hanging around afterward, and I will be glad to fill you with as much information as you want to learn.
Great. Thank you very much for doing your program.
You're welcome. Thank you, guys. Thanks for listening.
So I have several questions from online, and we have some questions in the audience. First question is, what should I look for to get a proper assessment? Is there some kind of standardized test that could be given for anything to do with speech or language?
Yes, I didn't talk about that because that involves a whole nother process. In order to get to a speech language pathologist, you have to have a referral from your physician, whether it be your regular physician or whether it be your neuro or anybody else on your team. If they have MD behind their name, they can refer you to speech therapy. Most outpatient places will ask you for insurance benefits, which you will obviously need to provide. I'm going to warn you, some places don't take certain insurances, which is really sad and unfortunate and unfair. However, back to the process, you need a doctor's referral before you even get to the speech language pathologist. Once you're there, there are a plethora of standardized assessments. Just to give you a couple of examples, for swallowing, the one I like to use is called the Mann Assessment of Swallowing Abilities. The acronym is MASA. It's a standardized assessment of swallowing function. A cognition test that I like to use is called the BCAT. And again, that one requires a special license. But there are others out there. They can Google standardized assessments for speech language pathologists, and they will come up with a list. Cognition-wise, again, I like to use the BCAT. That involves the 6 pillars of cognition. Voice, I don't believe there's a standardized assessment for voice. It's more of an informal assessment. It's basically they're going to listen to your voice and they're going to calculate what areas you need to work on and what is wrong with your voice, essentially, and where they need to go with the exercises. Language, there are standardized assessments, but again, Google it. There are plenty of resources out there of how to find which ones that the speech language pathologist may use. Each individual speech language pathologist has their own, their favorites that they like to use. There's not one set that's guaranteed for all of us.
Okay.
I hope that answered the question.
I'm sure it did. Before I get to some of the questions in the audience, one that was of interest to me is I want to know, what is it called when the brain and the mouth do not correlate? Okay, so a person is thinking about something but cannot get the thought to the mouth to say it.
Dysphagia.
Thank you. And does that only happen with MS, or is it multiple neurologic disorders?
Multiple neurological disorders. It can happen with acute illness. A lot of things that we know about, urinary tract infections. If you have an active infection of some sort somewhere, it can cause dysphagia. It can also make your muscles weak. I'm going to say one thing about muscle weakness. So when your muscles get weak, they do not discriminate between arms, legs, swallowing, voice, or breathing. One of the areas, again, I can talk all day long on all this stuff. So when you guys want more details, look me up.
Okay. There's a lot of people online that have questions. I'll get back to you all in a few minutes, but right now I have to do some from the audience.
I have a question. So the vital stem that you talked about, is that the same thing? I've heard people get their throat stretched.
No, ma'am. That's something completely different.
So what's the benefit of the throat stretching, I guess?
So the throat stretching is done by a physician, usually a gastrointestinal doctor, a GI. And that is when you have a stricture or a closing of your esophagus, which is your food tube.
Oh.
And then they have to reopen it.
Okay, thank you.
You're welcome.
I have two questions.
Yes, ma'am.
First one, what and if it's related, does a postnasal drip have to do with the swallowing and voice? That's the first question.
Okay, so as you can hear, my voice right now is probably due to postnasal drip. What happens when you have postnasal drip, it coats your vocal cords a lot of times. And then either it produces a cough, which will inflame your vocal cords, or it will just produce a autonomic inflammation of your vocal cords because it does not like that extra coating of whatever you got dripping down the back of your throat. Remind me of the second part.
That was the first. That was one. The other one is, in a situation where it's a noisy situation and someone is trying to speak and their voice suddenly gives out or stops producing much sound, what would that be related to?
So it could be related to your vocal cords are not functioning at its optimal speed. Kind of like we like to think about and what we describe as boys going through puberty. They're called pitch breaks. So if you're talking for a long time without some sort of hydration, like I just did, it's not really recommended, but in this situation it was necessary. Sometimes you can get that pitch break where your vocal cords are not completely sealing on all 3 points. So you have a top, a mid, and a low. If they don't seal at all 3 of those, you get a pitch break, which is exactly what you just were talking about.
You had made the statement that it was 13 muscles, I think, involved with speech, swallowing, and voice.
Yes, ma'am.
So do you actually work on pronunciation
Yes,
at
ma'am.
all? Is that part of your...
Yes, ma'am.
And do you work with children?
Yes, ma'am.
Okay. As young as 3 years
Yes.
old?
Yes, ma'am.
Who haven't begun to speak at all or poor speech?
Yes, ma'am.
Okay.
I sure do. See me afterward and I'll give you a business card.
Okay. So most people are really happy when they hear that in the afternoons, 3, 4 o'clock, I can't talk. My vocal cords get spasticity. Okay, and it's extremely difficult for me to speak at that time of day. So if anybody wants to not hear me, call me at that time. All right. What can be done about that?
So when you have spastic vocal cords and they just don't want to work, they kind of lock up like any other muscle. When it gets spastic, it just doesn't want to work. So what you need to do, Stuart, is relaxation techniques, water, and we need to teach you some relaxation techniques for your voice.
That's good.
There are some, but again, you have to look up a speech language pathologist to get those specific exercises.
Okay, thank you for that.
You're welcome.
Next person online is asking, how bad is it for when he starts to like cough, he finds that he can't stop coughing. I mean, it's like even water doesn't help. So he gets told to get something to drink, and he finds that he's got to clear his throat constantly, and then he gets yelled at that clearing his throat is making it worse, and so he coughs more. So now what?
Okay, so what you just said is like a 6-part question, but anyways, I'll try and get to all of them.
Good.
So when you're coughing after you're drinking or eating and you're incessantly coughing, like you can't get your breath and you're coughing, your eyes are running, your nose is probably running at this point because you're choking. Please just continue to cough. Your body has this automatic function that when you're choking, you're just going to keep coughing until it clears out of your lung and your airway, whatever went in there that it didn't like. Please don't interrupt it with a drink of water. That's just going to confound the problem, I feel like. Wait till you're done coughing, then get your drink of water. And if you're not done coughing, you're just going to keep coughing. Sometimes it takes time. I've had the unfortunate experience of having one of these episodes. I tried to inhale and swallow at the same time, and it never works. I've tried it for the last nearly 50 years, and it hasn't worked yet. So I doubt it is ever going to work. Because when your body tries to swallow and when you try to breathe at the same time, your breathing wins every time. Your body anatomically and physiological cannot do the same thing at the same time. Your breathing will always win. So if you're trying to swallow something and breathe in at the same time, you're going to suck it into your lung, sadly. And then you're going to have one of those coughing episodes that Stuart described from the listener online. Okay. So yeah, keep coughing. I'm sorry that it's annoying whoever is listening to you. Maybe go into another room, go into the bathroom until it resolves. Eventually it will stop. It's just going to be uncomfortable and you will be out of breath by the time you're done.
Okay, thank you. What about for a person who's like got something caught in their throat and they don't want to breathe through their mouth because of fear of where it might go to wait, so they breathe through their nose instead, just so they could get air in even though the food may still be lodged?
Okay, so there's a couple of things you can do. When you feel like you have food stuck in your throat, and before you start coughing, what you're going to want to do, the first order of business is to tip your chin down to your chest, like that, and swallow hard. Yes, like that.
Show them. They don't see me.
Okay. So I need a drink first. Hang on, guys. All right, so now I can do this. So what you're going to do is if you have something stuck in your throat, you're going to gather up whatever saliva you have in your mouth. You're going to tip your chin down like this and swallow as hard as you can. Some of us are going to swallow harder than others. You really want to swallow like you have a golf ball in your mouth or a mouthful of peanut butter you're trying to get down your throat. If that doesn't work, if you can feel it stuck on one side or the other, so for example, if it's stuck on the right side, then you want to turn your head toward the left, this way, looking over your shoulder, and swallow as hard as you can. And what that does is it stretches out the right side where you think it's stuck, and it will actually help it dislodge. And then you can swallow it and not choke on it, hopefully.
Thank you.
You're welcome.
Selma Blair has something going on with her throat. Do people with MS lose their voice?
Can. Yes, ma'am. I don't know what the incidence of it is, but if I stand here and was to be talking for the next hour or so, I probably would lose mine because I can feel it kind of going. Hang on.
I think she has a similar of the vocal cord spasticity from what I heard.
Oh, okay. So definitely you're going to want to go see a speech language pathologist for some relaxation techniques and exercises that you can do to help relax the vocal cords. If that doesn't work, you need to see the ENT. There are things that they can do to inject to help relax your vocal cords.
Okay, thank you for that. Next question online. Lots of. All right, can singing music help with exercising your throat muscles?
Yes.
Unless you're a screecher, right?
So music has a lot of different benefits to it. It's good for your brain. It exercises a different set of brain functions than what you do every day. It uses the opposite side of your brain. So again, if it's a new song or a new genre of music you guys don't know, again, it's good for brain health. It's a new skill. I would definitely start with hydration before you start singing if you're going to be singing for long periods of time. If you're singing for enjoyment, then yeah, it's good. It's good for muscle exercise. Absolutely.
Person writes, is there a treatment for lip numbness, like exercise or something? When I speak for a long time, my speech is affected, but it seems to happen because my lips go numb.
I've actually never had that question before. So, but yes, there are. Again, it may be, I'm trying to think. There are treatments for that. It usually involves, again, accessing speech language pathology services, but there are things like cryotherapy which is ice therapy.
Okay. All right. Next, sometimes I choke when I eat watermelon. It's scary and hard trying to catch my breath. What's this all about?
So when you eat watermelon, it's what we call a mixed texture because it has liquid and solids mixed in the same food. Soup is another great one for mixed textures. Salad that we had at lunch is another mixed texture because of all the stuff they put in it. My best suggestion for that person is to let the watermelon not be ice cold because the water will drain out of it more than when it's ice cold. And she needs to seek speech language pathology services to help with those swallowing muscles.
Okay, thank you. Next one is on food allergies such as tree nuts and what it does to the throat. Walnuts, almonds.
So if your allergy to nuts is bad enough, you're going to get what they call anaphylaxis reaction, and it will just make everything swell shut. That's really all I can say about that. As not being a medical provider, I don't really know exactly all of the ins and outs of that, but my best advice is to just avoid them.
When that should happen to somebody, is there a quick cure for it?
No, they need to call 911. Okay. That's the quick cure for that.
Okay. How does your brain know to swallow when you have cognitive problems instead of you choking?
That because your swallowing isn't considered one of your autonomic functions, sort of. So when you have cognitive difficulties, it depends on how severe your cognitive difficulties are. So if we think about cognition and swallowing, your skills develop when you're very little. Swallowing develops before your cognition does. Swallowing develops in utero, and cognition is a learned process as you grow through the years. Now, when we get to a certain point, as we all age, things work in reverse. So the skill you learned first is the skill you lose last. So as we go through the aging process, your brain functions will go before your swallowing does.
Okay, thank you for that. Going back to your first slide, where you had the 4 things, I believe it was, listed at the bottom. Can you just give a quick meaning of each as a final wrap-up?
All right, so dysarthria is a slow and slurred speech. Could be garbled, could be any one of those number of different things, could be all of it. So dysarthria happens when you have muscle weakness of your tongue specifically. You have 3 sections to your tongue. You have a front, a mid, and a back. Usually with dysarthria, it's the front third of your tongue that's impaired. They split your tongue into 5 sections. So you have, like I said, the front third, the mid third, and the back third, and then they split it down the midline. Not literally, but that's just kind of the visualization I like to use. The front third is the most important when it comes to dysarthria, the tongue tip. That is what is the most important for speech precision when you speak. If you sometimes have had a stroke, a mini stroke, MS, any other sort of neurological condition, anything that affects that front third of the tongue, which is cranial nerve number 12, that controls your tongue.
Thank you.
You're welcome.
And the next, dysphagia. You don't have to click.
Oh,
it's
there
there.
it is. Dysphagia. It's okay. Everybody makes that mistake. And the only reason I specify that is because of that. Dysphagia and dysphagia are 2 very different things. Dysphagia is a disorder of swallowing. Dysphagia is a disorder of language. So dysphagia is just that. When your swallowing doesn't work. It's a big fancy word.
Okay, thank you for that. And then you have voice, just a quickie definition.
Voice is anything that doesn't sound normal. And everybody's normal is different. For me, my voice today is not normal for me. I don't always sound like this. Some people do. If you've been a smoker for a long, long time, sometimes it can affect your voice and you sound like this. And I call this my gravel Gertie voice.
Okay, and cognition?
Cognition is memory. That's one easy word. There are 5 other areas involved with your cognition, but the primary one is your memory. And that's really what we consider sometimes the most important when we talk about cognition,
And
being able to remember things.
And the last to wrap it up, dysphagia.
Dysphagia is a disorder of language when you can't find the right word or you have difficulty being able to come up with what you think should be the word. For example, apple. We all know what an apple is. It's red, it's round, it tastes delicious. So sometimes when you have dysphagia, what you may be talking about in a conversation is, hey, you know that thing that's red and round and is delicious to eat and it's juicy and it comes from a tree? That's dysphagia.
Well, thank you very much, Tina. We really liked having you here today.
Good, thanks.
Awesome.
I love being here. And again, if anybody has anything more specific and they want more details, just look me up.
That's right. Thank you for that.
Thank
Sorry about
you.
that. All right. And for now, I just want to thank you all for coming here today. And I want to thank our online audience, of course. Let's say goodbye to everybody, okay? Have a great day. Thank you.